Welcome to our 5 on 5. Please be joined again by Kristin Fettig, a suicide prevention coordinator with Jackson County Mental Health. Thanks so much for being here today.
Yeah,
Good to see you again.
thanks so much. Yeah.
So we're here today. NBC5 News and dozens of other newsrooms throughout the state this week are working together. We're breaking the silence and we're trying to talk about suicide. That's why we wanted you here today. Why is it so important we talk about suicide?
Mental health in general is something that we need to talk about in the community, but suicide is something that seems to be looked at as taboo, and it's something that's uncomfortable for people. But really what we need to be doing is doing the opposite and actually talking about it, because those people that need help are going to feel more comfortable if we do start those conversations that we're worried about somebody, and then they're going to notice that you're a safe person to talk to.
Yeah, what I don't know how the correct way to answer this is. It's a pretty big question, but what is the big picture view right now on mental health in Jackson County?
Well, I think that people are just reaching out for help more. So I wouldn't say necessarily that we're seeing more mental health, but I think that people are reaching out more, which is super important when we're trying to help prevent suicide in the future. So we have our crisis departments and things like that people are more aware of. Yeah,
and how many people are personally affected, whether it's a distant relative or an immediate family member? You know, what percentage of the population is affected by suicide?
So just from my trainings that I do in all different groups of people, from students to adults, it's usually between 30 to 70% of people, and usually adults, it's more like 80% of the rooms that I train have been affected by a suicide.
And I know youth suicide is something that we've seen locally, and you go, and as well as the organization, go into schools to talk about this stuff. Yeah. What do kids tell you, or what's that presentation like?
Yeah, so a big part of it is education and breaking that silence, right? It's something that we can talk about, and if you need help, you can talk about it, you can ask for help. If you're worried about a friend, this is how you get help. So those are the main messages that we do. But the concept for schools is youth really want to learn about suicide because adults aren't talking about it, and so they tend to be a little bit more progressive in the fact that they want to talk about suicide and they want to learn about it.
What kind of feedback do you get from the kids and from the educators? I imagine these conversations are hard. Are educators, parents, are they apprehensive about how that conversation goes?
I think in the beginning when we started working in schools, it was kind of some apprehension, but they tend to be really receptive and thankful because they notice that teens are more willing to talk to adults about their whatever's going on, mental health in general, and that's something that kind of helps bridge that gap and have less behavioral problems in classes. So I think that that's helpful.
Interesting. Well, I'm curious, what age do those presentations start at?
6th grade is the youngest, and that's for the evidence-based programs. I use a program called Signs of Suicide, so SOS.
Okay, interesting. All right, we're going to take a quick break. Okay. Much more in a moment. Stay with us. Welcome back to our 5 on 5. We're going to hear Kristin Fettig, a suicide prevention coordinator with Jackson County Mental Health. We're talking about breaking the silence all week long, along with newsrooms across the state of Oregon. So we were talking during the break about a coalition, Jackson County Mental Health. You're not alone on this. There's a lot of other organizations. Can you tell us the work being done? Yeah,
so Jackson County Suicide Prevention Coalition. I'm the chair of that committee, and what we do is we have a lot of different community partners, different community programs. We have a representative from each of them that come, and it's a group effort. We talk about prevention. We have a lot of local trainers that come together and we get the words out about different trainings that are going on, and also have kind of different efforts around the county.
Yeah, and we talked before about how you personally, as well as other people, are going around to schools and talking about this with kids, because it's important, as we're talking about, breaking the silence before we have these conversations. What can people do who are here at home right now who may not be able to attend anything like that to educate themselves about suicide?
So there is a program called QPR, so it's Question, Persuade, Refer, and you can actually go online and just look that up. And you can get trained. It's about an hour and a half class, and it's $30. So that's a great resource. But there's also good resources like American Foundation for Suicide Prevention. So that website is afsp.org. And you could go on there. There's trainings that are for free. There's a lot of different information about risk factors, warning signs we need to look for.
Okay, and what about, of course, since we're here and we're talking about this stuff, I know you guys, Jackson County has your own crisis line.
Yeah.
What number is that, and beyond Jackson County, of course, if you have all that information available?
Yeah, definitely. Yeah, so our number is 541-774-8201, and that's for our Jackson County line, but a lot of other counties have their own crisis lines, so it would be something that we can look up.
Okay, and I guess there's that text line that you said is pretty popular with youth?
Yeah, crisis text line is 741-741, and it's really simple. You just send a text, and then you can get connected to a crisis counselor via text, and so you text back and forth and have that conversation with them.
Interesting. Yeah. Okay. Well, great to talk about it. Great to break the silence, and hopefully the conversation continues.
Definitely. Thanks
All
so
right.
much.
Thank you.
Thanks.
Stay with us. We'll be right back.